All right. Thank you for joining us. We are going to go ahead and get started. So, again, you have joined North Kansas City Hospital's Healthy Living Series, and today we are talking about fibromyalgia. We have Jennifer Reno with us today to install some of her experience with you. So, Jennifer?
Yes, hello. Just a little bit about me. I am a director of nursing professional development, nursing education here at North Kansas City Hospital. I've been here for almost 22 years, and I love this hospital. I have been living with fibromyalgia or fibro, just shorten it, for 11 years. And kind of tough, stressful situation right now. Have a lot going on, obviously, at the hospital. Just a couple of disclaimers. I'm not a medical expert at all in the least. Just a person living with it, having learned to live with it, still learning to live with it. Kind of ironic that the talk is today because with the weather situation, I woke up hurting a lot this morning. One of my triggers is colder weather. So with this weather front coming on, this morning was one of those trigger days. So again, kind of ironic. Not endorsing any kind of treatments, no medications, no products, just again, some things that over 11 years, I've learned to deal with just for myself. Everybody's a little bit different, but just some things for me. And finally, again, things have been going on at the hospital. We have a number of COVID patients. We have a lot of onboarding of new nurses, agency nurses that my department is in charge of. So I really kind of just put this together yesterday. So if you see any typos, sorry about that. So we can get started. The screen that you see, I'm going to turn this off so you can see it. This is a t-shirt that I actually have and wear. Every part of my body hurts. And that is so true. Sometimes head to toe, front to back, everything hurts. And I know sometimes when others say, oh, my head hurts, my back hurts, I just kind of want to kind of throat punch them because I think I hurt every single day, everything that I have. Sometimes the fingers hurt, the toes hurt, just sometimes my eyelids will hurt. You don't think eyelids can hurt, but eyelids will hurt. So I kind of like this t-shirt and like to wear it on days when I'm hurting. And there we go. So what is fibro? Is it real? Absolutely, yes, it is real. I have had people who have said, "Oh, it's all in your head." It's not real. It's not a real diagnosis. It is a real diagnosis. Finally, physicians did realize that it is something that it's not just hormones or in someone's head or somebody who has a low pain tolerance. It actually is a muscle disorder. It causes pain, muscle tenderness all over the body. It causes, along with it, sleep problems, which lead to that fatigue, memory, mood issues. They call it kind of a fibro fog. It is not an autoimmune disease. A lot of people think that it is, but it's just that muscle disorder. There is not a known cause. There are a lot of theories out there about possible causes, but they still really aren't sure. They do think that it's a combination of many emotional and physical stressors versus just one action or one occurrence of something that has caused it. So multiple things over sometimes weeks, months, and sometimes even years. They have seen elevated levels of a nerve chemical that's called substance P, which actually increases pain signals in the body. Serotonin levels in the brain have been reported to be low in fibro patients. One of the reasons that it can also cause depression, and one of the reasons that antidepressants are sometimes a treatment that goes along with fibromyalgia. Patients with fibro have known impaired non-rapid eye movement, which prevents the deep sleep and causes us to wake up feeling tired. I don't know how many times that I will actually say to my husband, I don't know how I can feel so sleepy after just having slept all night. I don't get that deep sleep. I wake up many times at a night. I will hear a noise, I will wake up. Last night, I think I woke up 4 times. And so you do wake up very tired. Just that constant being tired, just tired. Researchers think that people with fibro feel pain differently because it affects the way that the brain and the spinal cord process those pain and non-pain signals. Very common, more than 3 million cases in the US every year that are real, that are diagnosed by physicians. So the fibromyalgia pain is widespread. It involves both sides of the body, top and bottom, so arms and legs, the trunk as well. Neck, my neck was hurting today, headache, the buttocks, the shoulders, the arms, the back, the chest and the front. Just aches all over the body. There are painful, tender points, 18 of them that we'll show you kind of a diagram of. Just constant back pain, neck pain, shoulder pain. I know my shoulders just are constantly tight. They feel like almost concrete. People will, touch your shoulders, try and rub them or just give them a squeeze. And my sons will do that and they'll go, gosh, Mom, you're just so tight. And it's just that constant being tight, just constricted, contracted all of the time. The pain can be aggravated sometimes by noise. That's not really ever affected me. Weather changes absolutely affect me. Cold and rainy, wet weather, and if it is cold and wet weather together, I'm usually home in bed that day and sometimes for a day or two. Just can't, what I call put on the Pollyanna, put on the act of, oh no, I'm okay, it's okay, I can keep going. Just can't do it. Just have to kind of live through that 24 or 48 hours to get back to where I can move and look like my age instead of somebody who's maybe 90 or 95. Emotional stress or just stress in general. And I have felt that many times over these past almost 2 years in the COVID pandemic that we've been living through, within my department, within the hospital in general, within my son, my grandsons having COVID, within myself having COVID, and the stress that has caused, the stress of the constant changes at the hospital, the stress of just constant agency and orientation and the work that I do, working 10, 12 hours a day, knowing that I can't do that to myself, to my body. I have to listen to my body and not stress it out, because if I do, I have that constant pain and I'll put myself down on the couch for that 24 or 48 hours. So if I'm not going to have to be home, if I have to be at work, if I need to be at work, if I want to be at work, then I have to listen to my body and I have to take care of it so that I can do what I need to do, so that I have that quality of life that I want to have. I have to listen to it. Those tender points. So here they are. They've been known for quite a while since the diagnosis was made. This is really part of how fibro is diagnosed. These points, even though they're kind of large in this diagram on our bodies, they're about the size of a penny. The cause is unknown. They thought that they are inflammation. For me, they are inflammation. I can feel it. My massage therapist can feel it. Doctors can feel it. Every one of these points for me is positive. So I have 18 out of 18 of those, and have had for 11 years. They're not always tender, but I would say probably about 85% of the time they are tender. Usually when there is a flare-up, they are all tender, not all of them at the 10 out of 10 on a pain scale, but they're all somewhere definitely above a 1. I've always teased my doctor that fibromyalgia patients should have a different pain scale, because for us, 0 to 10, we're never at a 0. I usually live at a 3 to a 4. I can actually function and be at work clear up to at about a 7. But when I get to an 8 and a 9, that's when I'm at home. I've never said I've been at a 10, because if that's the worst pain that you've ever felt, I'm not sure that I've ever been to that point. I don't want to get to that point, but definitely have been at those 8s and 9s, usually on those weather days, or those days that I have not listened to my body and have been under stress for a while and need to take that time. So these are the points. You can kind of feel them. If you just press on them and you experience pain in those areas. It doesn't have to be severe pain, but it's definitely not a normal feel. If you were to feel anywhere else and press anywhere else, there wouldn't be pain, but in those areas there is pain. So risk factors for fibro, definitely age, middle-aged and older. So I'm 53, been 11 years, so 42. And if you've had or do have lupus or rheumatoid, you're at a higher risk. Women are twice as likely as men. And that's what I have seen as well. I know quite a few women who do have it. I do believe that my oldest son probably does have it, or a likelihood to develop it, based on what he has told me and based on the tender points that he has. If you've had a stressful or traumatic event in your life, again, that goes back to some of those beliefs of what causes fibro. Repetitive injuries, so frequent bending, stress on joints, possibly just that damage that comes from that, the inflammation that comes from that on our bodies. Illness, viral infections, Guillain-Barré, if anyone has had that can cause it. Definitely there is a family history, and that is very true for myself, my mother, my grandmother, and my great-grandmother. I know definitely had it based on their symptoms. It wasn't a diagnosis for them because it was before it was a diagnosis, but knowing what their symptoms were and what mine are, definitely they had it. And then obesity can also be a risk factor. They do wonder if hormones play a role as well, especially because up to 90% of all people with fibro are women. So they do wonder about female hormones. Signs and symptoms, it's just that pain, that stiffness all over the body, getting up and having to kind of stretch before moving, not feeling like you can take a full stride, sitting for too long, and that low back hurting, muscle twitches, muscle cramps, fatigue, that tiredness, depression, and anxiety kind of go together. The fatigue, the sleep problems, not being able to sleep all night, the problems with thinking and concentration, they call a fibro fog, forgetting words. I will do that constantly. I can describe it to you. I know exactly, I can picture it in my head, but the word is just gone. I will go from one room in my house to another room to get something, totally forget why I went there. It is worse when I have a flare, when I am hurting worse when I get to that 6, 7 on the pain scale versus when I'm down at the 3 to 4. Definitely headaches, problems with migraines, tingling or numbness, pain in the face or jaw. So if you have TMJ, and then a lot of digestive problems like irritable bowel syndrome can go along with fibro. So it affects you from head to toe. It's an entire body disease. How it's diagnosed, usually by a rheumatologist versus a family doctor. It's based on your history in that physical examination. So it's those tender points, and usually have to have 11 of 18, and it has to be present for longer than 3 months, and it has to be present in both legs, both arms. So both sides of the body, so all 4 extremities. There are no lab tests, x-rays or MRIs. If they do any of those tests, it's often done to rule out other conditions that someone would have. Just very difficult to diagnose because the symptoms are so similar to other medical conditions that someone could have, can lead to misdiagnosis a lot. Doctors, again, it depends on if the physician believes that fibro is real, if the physician listens to you. I had a doctor early on that I was hurting and would go to her, and at that time she said, "I don't know what more I can do for you. I think it's all in your head, and I think you just need to get over it." Well, that wasn't helpful because I knew it wasn't in my head. I knew how badly I was hurting, and she wasn't listening to me. And so that was the last time I saw her. And I had to find a doctor who would listen to me. And now there is a study going on that there is possibly a blood test for fibromyalgia, specifically for fibromyalgia, and it's called an FM/A test. And it looks at the concentration of cytokines, which are proteins that help the body's immune system and the inflammation responses. So again, thinking more of that inflammation that occurs in the body. They think that the lower levels can be an indicator of the fibromyalgia. And at this time, the test is extremely expensive. It's still in the study stage, and they're still doing clinical trials. But there is possibly hope on the horizon that people won't have to go months to years before they get a diagnosis. Somewhere I read that it can take up to 5 years before a diagnosis is made, just because fibromyalgia can mimic so many other conditions, and so many times it will take months before a condition can be ruled out, and they'll try other treatments for so many months before they'll look at a different condition, and then that will take months, and then they'll try another treatment, and then that will take months, and it just can lead to a long time of hurting, and that can also lead to that depression, and that leads to anxiety, and that leads to the sleeping problems. And so it just kind of compounds on itself, especially if you don't have that doctor who will listen to you and who does want to help. So how do they treat it? Unfortunately, a lot of the doctors, especially if it's not that rheumatologist, if it's a family doctor, they really kind of like to throw medications at you. There are anti-inflammatories, there are over-the-counter pain meds, there are antidepressants, anti-seizure medications, muscle relaxers, sleeping pills, that they just kind of want to throw that medication at you. And very honestly, that did happen to me. What are you going to do when you're hurting? And it got to the point that when you're hurting and you have flare-ups and you go to the doctor because you're hurting and you're not de-stressing and you're not listening to your body, and the doctor just increases those medications. And for me, it got to the point that I finally had to say, listen, stop, because all we're doing is masking and we're not taking care of the actual problem. And we're going to get to the point that I'm going to be on so many pills a day that I'm not going to be able to function. So let's bring me down off of this and let's actually look at the problem. Let me find what's going to work best for me, and let's go from there. And the doctor that I found was fantastic. She does listen to me. She's great. So I did a lot of research into the self-management strategies, muscle strengthening exercises that I found that worked for me, some physical therapy. The aerobic exercise for me, I found actually makes it worse. It really makes my muscles contract to the point that they really are rock hard, rock solid, and they don't relax. Diet, limiting caffeine intake, stress management, meditation is great. Listening to music will really relax me. Yoga will help. Massage therapy, that is the one thing that I have found for me helps probably the most. Good sleep habits. I know I have to have 8 to 9 hours of sleep a night. So I'm in bed by 8 o'clock to 8:30 every night. I have an app on my phone that sings me a little lullaby 15 minutes before I have to go to bed. And even my grandsons know that when that little app sings to me, oh, Nanny's got to go to bed, and I have to get that sleep. Talk therapy is great. Journaling is great. Documenting those symptoms. And when you're having the flare-ups, and documenting what's happening, what's been going on in your life, what your pain level is, and what you're doing about it also does help. Warm Epsom salt baths help. You know, that's also something to do in a nice jacuzzi with warm water is really great. A weighted blanket has helped me with the sleep. Those are things that aren't medications that don't get thrown at me. Vitamin D, my vitamin D level was very, 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 very low. Once I got my vitamin D level up, that helped a lot with the muscle pain as well. So again, that's a lot more natural than having just medications thrown at me. So complications, we're twice as likely to be hospitalized. It is said that we will have a lower quality of life, but you don't have to if you choose not to. It is a choice. 3 times more likely to have depression. Again, it's how you look at it. It's how you want to choose how you deal with it, and if you want to live with it or if you want to suffer from it. I choose to live with it rather than suffer from it. Higher rates of other rheumatic conditions. I hated this one, higher death rates from suicide and injuries, but the overall mortality is very similar to other general populations. So I think that's a good thing. That says we can live as long as anybody else. This is not going to kill us, especially if we choose, but it's not going to. So my tips: find a doctor you can trust who listens to you. Keep a food diary to determine any foods. Gluten, dairy are 2 that really can negatively impact the pain that is felt. They say to try a vegetarian or a vegan diet to help reduce symptoms. Again, I think that goes to the inflammatory reaction that can occur. Know your triggers and how to avoid them, and avoid them at all costs. Recognize when you're beginning to have a flare-up and treat it immediately, however you choose to treat it. Reduce your stress. Listen to your body. Know when you're beginning to have stress and stop it, because that will really lead to that flare-up. And then know what helps keep the pain away and do that. And for me, my pain is that deep tissue massage. I found what I call my muscle gun, Again, not endorsing any products, but for me, that thing is amazing. I put it on those 18 tender points and just let that baby go to town. And that really does help. Sometimes I leave bruises, I must say. The anti-inflammatory creams and the roll-ons, those are all natural. So I'm, again, trying to stay away from those medications and go as natural as possible. In the upper right-hand corner, I do use a TENS unit, and that helps tremendously. It will really relax my muscles a lot. It takes them from concrete to gravel, I guess, if you will. And then in the middle is my travel trailer, Susie Q. And when I go to her or just think about her, that will relax me. And that is my de-stressing, as well as my two little grandsons in the bottom right, Carter and Luke. And just, again, those two will totally de-stress me and put me in my happy place. So those are my tips from, again, someone who lives with it, not someone who chooses to suffer from fibro.
All right, Jennifer, thank you so much. Let's go ahead and see, does anybody have any questions? So I have to tell you, I have not seen that Outback roller that you have on there. Very cool. I may have to try that. And I know you're not endorsing it.
I'm not. No. No. It's natural. It's olive oil, it's tea tree oil, and it's eucalyptus.
Ooh. Nice.
So again, it decreases the inflammation.
Awesome.
And it smells good.
I bet. I bet it smells really good. Okay. All right. Well, Jennifer, thank you so much for coming on and talking to us. And I'm going to go ahead and wish everyone a good day.
All right. Thanks, Shanna.
Thank you. Bye.
Bye-bye.